Welcome to Dr. Home. Depression, the silent assassin. Depression, one of the most common mental disorders worldwide, is increasingly gaining traction. According to WHO data in 2023, about 280 million people have a depressive disorder, accounting for an estimated 3.8% of the world's population. This shows the importance of understanding and caring for people with depression, because this disease impacts not only mental but also physical health, life and joy of people. In the context of the COVID-19 pandemic, depression has become a topic not to be missed in the field of mental health. But do we have a clear understanding of the symptoms of depression and the ability to recognize the stage of the disease? Those are the questions that today's video will explain to you. What is depression? According to the National Institute of Mental Health, depression, also known as major depressive disorder or clinical depression, is a common but serious mood disorder. It causes severe symptoms that affect the way a person feels, thinks, and handles everyday activities, such as sleeping, eating, or working. People with depression may have experienced major life events, such as bankruptcy, unemployment, debt, divorce. However, there are also cases of depression without major events. Simply changes in daily life such as promotion, change of living environment, change of job, marriage. These events can have a powerful impact on people's personal and spiritual lives, creating significant change challenges. The incidence of depression is increasing, especially among women, and each year hundreds of thousands of people die from depression-related suicidal behavior. According to the World Health Organization, WHO, about 280 million people around the world suffer from depression. Depression is about 50% more common in women than in men. Worldwide, more than 10% of pregnant women and women who have recently given birth suffer from depression. More than 700,000 people die by suicide each year. Suicide is the fourth leading cause of death among 15 to 29-year-olds. Depressive disorders not only affect a person's mental health but also have a significant impact on family and social relationships. It creates a feeling of loneliness and alienation, causing difficulties in work and daily life. Although it is a serious illness, depression can be treated and cured completely. Timely recognition and treatment of depression is necessary to help those affected overcome the crisis and regain their quality of life. Who are susceptible to depressive disorders? According to 2019 U.S. National Center for Health Statistics data, 21% of adults between the ages of 18 and 29 experienced depressions within the last 2 weeks. This is the largest proportion of the adult age group. The percentage of adults with mild depression is mainly concentrated in this group. So, although depression is common among young people, it is also less severe. Adults age 30 and older are less affected by depression. But depression has a significant impact on adults aged 45 to 65. Severity seems to subside in adulthood, with people 65 and older often experiencing milder symptoms. Besides age groups, there are some groups of people who are at high risk of developing depressive disorders, such as group of people experiencing psychological trauma, people who have experienced big and unexpected events in their lives such as bankruptcy, loss of property, debt, loss of loved ones, divorce, problems with children, excessive work pressure, postpartum women. This is a sensitive and high-risk period for women. Rapid changes in hormones, family and life roles, lack of sleep, and previous difficulties may contribute to an increased risk of postpartum depression. Students, excessive academic pressure, a high number of assignments and exams, pressure from parents and teachers, Evaluation of academic results can create pressure and cause depressive disorders. People with bodily injuries, people who experience an accident, loss of a part of their body, traumatic brain injury, cancer, dangerous infectious diseases are at high risk of developing depressive disorders. Alcohol and stimulant abusers, people who use alcohol and stimulants for a long time are at high risk of developing depressive disorders. People who lack motivation to live, people who lack supportive relationships, the ability to communicate, do not know how to cope with stress or encounter other difficulties, such as financial problems, work. What are the causes of depression? The cause of depression cannot be determined specifically, but it is possible to identify factors that are more likely to cause the person to become depressed than others. Here are the causes of depression. Pathology or trauma. People with a history of brain diseases such as encephalitis, brain tumors, or a history of traumatic brain injury are at higher risk for depression due to structural brain damage. Substance use. People who use substances such as tobacco, alcohol, drugs or meth are at higher risk for depression because these substances cause neurological damage. Prolonged stress. Stress from work, family, conflict, and stressful living environments can contribute to depression. Depression of unknown cause, endogenous. Depression can occur due to a disturbance in the activity of neurotransmitters in the brain, such as noradrenaline, serotonin. Genetic factors, changes in brain neurotransmitters, stressful environments, and psychological factors, such as past traumatic experiences, can all increase the risk of depression. Depression can be caused by many things, including endogenous factors, prolonged stress, and pathologies or injuries that directly affect the brain. However, in some cases, the cause of depression remains unclear. What are the symptoms of depression? Symptoms of depression can be identified based on the following signs and symptoms. Unexplained aches and pains. Depression can cause aches and pains all over the body. Although physical examination results may be normal, pain may be accompanied by other symptoms such as bloating, back pain, joint pain. Distractions. Depression is often accompanied by a decreased ability to concentrate and reduce work performance. You may become forgetful, have difficulty making decisions, and frequently make mistakes. Changes in sleep. Sleep disturbances are a major symptom of depression. Some people may have difficulty sleeping too much, while others may have difficulty sleeping too little. Changes in appetite. Depression can cause significant changes in appetite and weight. Some people may become overeating, while others may lose their desire and appetite. Irritability, agitation, or moodiness. Irritability, agitation, and moodiness are other signs of depression. Small things can upset you more than usual, and you may have thoughts of self-harm or a desire to harm others. If you experience these feelings, you should seek help immediately. Loss of interest in previous hobbies. You may lose interest and pleasure in activities that you previously enjoyed. Sexual desire may also be impaired. Feelings of worthlessness, self-blame, despair. You may feel worthless, guilty, and have no faith in yourself and the future. Feelings of hopelessness and lack of escape are evident in your thoughts and feelings. Feelings of unprovoked anxiety, phobias. You may have feelings of unfounded anxiety, fear, and phobias about illness. You may also get angry easily and show little interest in others. Suicidal intention and behavior. Suicidal intention and associated behaviors are a serious aspect of depression. You may have thoughts of death and feel hopeless, with no way out. You may be obsessed with thinking about illness and at risk of self-harm. If you experience these symptoms within 2 weeks or more, According to the American Psychiatric Association's diagnostic guidelines, it is recommended to seek help from a psychologist or medical professional for appropriate evaluation and treatment. What are the levels of depression? Depression is often divided into different stages based on the manifestation and severity of the disease. Although there is no formal and uniform classification, below is a common classification of depressive episodes. Mild depressive episode. During this period, people with depression often have some symptoms of depression such as loss of interest, fatigue, feeling sad and reduced interest in daily activities. However, these symptoms do not have a major impact on the person's ability to function and quality of daily life. Moderate depressive episode. During this period, depressive symptoms become more severe and significantly affect daily functioning. People with depression may become insomniacs or sleep more often, disregard self-care, often have a negative mindset, lose confidence, and feel worthless. They may feel tired and lose strength, have poor concentration, and have difficulty making decisions. Also, thoughts of suicide or death may come to mind. Severe depressive episodes. This stage is the most severe level of depression. Symptoms of depression become extremely severe and affect almost all aspects of life. People with depression may have difficulty performing basic activities such as bathing, eating, and personal hygiene. Insomnia or too much sleep may appear, and they may experience feelings of hopelessness. Suicidal or self-harming thoughts can also become specific and dangerous. How to treat depression? Treatment for depression can be done through two main methods: chemotherapy and psychotherapy. Chemo-preventive treatment. Drug therapy is a common approach to treating depression. Scientific studies have demonstrated that antidepressants are beneficial for people with moderate or severe depression. However, in the case of mild depression, psychotherapy may be preferred. The type and dosage to be used as well as the duration of treatment will be indicated by the doctor. Currently, a variety of antidepressants are used, including selective serotonin reuptake inhibitors, tricyclic antidepressants, monoamine oxidase inhibitors, and atypical antidepressants. Psychological release. Psychological treatment is considered an effective method of treating depression in modern society. Psychologists have been trained in methods and techniques for psychosocial support for patients. The process of psychotherapy not only helps patients recover gradually, overcome the depressed feeling of depression, but also helps them better understand themselves, enhance their confidence and adapt to life. Today's video is the end. If you feel good and useful, don't forget to like, share and follow the channel. Thank you and see you in the next videos.